There seems to be agreement on this point. Vaccinations are not happening fast enough. This as the Wisconsin Department of Health Services Vaccine Distribution Subcommittee met to discuss which groups will get vaccinated next. Adriana Mendez has more on that.
As vaccination rollouts continue, the state's vaccination subcommittee continues to work on who will get vaccinated next. Health officials say the most important thing is to get people vaccinated as quickly as possible. In Tuesday's committee meeting, members agreed to include those who are 70 or older in the 1B category. According to the Wisconsin Department of Health Services, 71% of deaths and hospitalizations in the state come from that age group. The committee also discussed including in Group 1B people who live in congregate living centers. That's housing provided for 3 or more unrelated people that share bedrooms. Houses that serve those with disabilities would be an example. But committee members were split on whether to include domestic violence shelters or agricultural housing in Group 1B.
We need to be clear that with congregate living, we're talking about people at risk because they live with other non-family members.
There is an urgent need to move this process more quickly because of the new highly transmissible variant.
Another section that had committee members debating back and forth are non-frontline healthcare employees, such as the HR department, administration office, or the accounting department for hospitals.
I am very concerned that sort of including all of those individuals in 1B, when they really don't have any more risk of occupational exposure than any other person working in any other industry, really sort of is not really equitable.
Many committee members say the departments could work remotely. Others on the committee say those who work in supply chain or the IT department for hospitals are critical parts of the infrastructure.
If we don't have that people to do those key duties, we can't provide healthcare.
The committee announced 27% of people in Group 1A have been vaccinated already. And as they finish up the 1B list, the next step is to move on to defining those in Group 1C.
By defining 1B, we have largely defined 1C. At the end of the day, the most important concept for this virus is getting out as much vaccine as quickly as possible.
The decisions made will now go out for public comment as the committee continues to revise its recommendations. Reporting Milwaukee, Adriana Mendez, TMJ4 News.